Welcome to the Research Collective, your podcast for the latest public health research and insights on today's most pressing public health challenges. In this episode of the Research Collective, join us as we talk to a leading expert in the field of cardiovascular epidemiology as we talk about lifestyle factors that impact children's cardiovascular health and well-being.
Hey everyone, welcome back to the Research Collective, the podcast where we break down big public health topics with the expert who know them best. I'm your host Bipin, and today we are talking about kids' heart health and how habits like exercise, sleep, and screen time affect it over time. To explore this, I am joined by an incredible guest, Dr. De Moraes, our TRC founder, Deepali Honest, as well. Dr. De Moraes is an epidemiologist and assistant professor as well as a scientist. Dr. De Moraes brings a global perspective with research spanning in Latin America, Europe, and the US. His work focuses on cardiovascular health, lifestyle behavior, brain development, and how these interact with environmental and policy factor in young people across the different regions. He has published over hundreds of papers on youth health, heart disease, and behavior. We are excited to have him here. Dr. De Moraes, great to have you with us. We are really glad you could join us today.
Bipin, great pleasure to talk with you in the podcast. I'm very glad to be here.
Okay, to start off, tell us about what inspired your journey into pediatric cardiovascular health. Why focuses on kids?
So this started when I was undergrad student, and my first project that I participated was a clinical trial to treat obesity in kids in Brazil in that time. So that's how I started to understand obesity is affected the pediatric population health and how we can address this health condition. I continued this research into my master related with obesity in kids. And when I started my PhD, I saw some relationship between obesity and cardio health in kids. So, and this I jumped to cardiovascular during my PhD and work with determinants for hypertension in kids in Brazil and Europe. So my background or undergrad is kinesiology that is related with why I'm interested in lifestyle behaviors and how this related with hypertension.
That's really an inspiring journey, Dr. De Moraes. So now let's dive right in. What are some of the main lifestyle factors that can affect heart health in kids and teens?
So we can talk this mainly five behaviors, right? So we can address physical activity. So the kids practice physical activity and in regular days, the cardiovascular health is better for them because when you're going to practice physical activity, improve your conditions for blood flow, oxygen, and this is reduce your blood pressure. In the same times in nowadays, we know so kids spend a lot of time in screen time, computers, video games, TVs, and tablets and cell phones. You don't practice physical activity during this time. So one and another. So the relationship between screen time is bad for cardiovascular health or musculoskeletal and bones. And can increase the develop hypertensions. And as we saw right now, so the last 5 years or 10 years, we see this vaping use and can be worse for our cardiovascular health also because nicotine consumptions is related with increased hypertension risk in later life stroke or another health issue or chronic disease. In the same time, nowadays, another behavior that pop up is sleep hygiene, sleep health. And this is important because the sleep have a lot of relation with our circadian system and hormones, and this is strictly related also with your blood pressure. So if do you sleep adequate hours in kids is range between 9 to 11 hours a day, and this is going to be related also how we control our blood pressure during the day. So this is the mainly three or four behaviors. Also, we have to consider diet. In this case, consumption of unhealthy diets is related with the increase the inflammation in our cardiovascular system. This increase our blood pressure. So such as sugar beverages and snacks and red meats and processed meats is the how more the kids consume, even us adults, is more risk for increase our blood pressure and develop hypertension.
Those are great lifestyle factors, like you mentioned nowadays the screening time, vaping use, sleep health, and also the diet. Thank you for explaining those factors. And also, you have explored how these factors don't just affect the heart but also the brain. One of your recent study, we saw links between cardiovascular health and cognitive function and brain development in teens. So, can you also walk us through what were the main findings from that study?
Yeah, that's is my stepping forward in this field. We know so blood pressure is strictly related in adults and the elderly population to develop stroke and develop the risk to dementia and Alzheimer in adults and elder population. So right now, as we saw, the prevalence of hypertension across the globe is in kids is up to 10%. Obesity is around 25 to 30%, depends where we are. And diabetes also should have to increase. 1 to 5% has diabetes or glucose impaired metabolism, you can say that. And this combination is related with dementia, Alzheimer, and stroke in later life. And our hypothesis in this paper was, okay, we know dementia not develop in 1, 2, 3, 4 years. They have a long process on this. And probably this is started when the kids start to be obese, start to have hypertension, or diabetes during the adolescence. And we test this hypothesis in these American adolescents. And we found that the kids have better cardiovascular health, so have a normal blood pressure, they are not obese, and they have the normal glucose metabolism. They have a better cognitive function scores in tests, and they have more volume of the brain. Why this happens in some papers showing us the kids have present this cardiovascular risk. They have more inflammation inside the brain, and this is going to be harmful for the brain development also because we have more inflammation in the brain, and the integrity of gray matter and white matter can be compromised. So this is our hypothesis right now. Is we still follow up these adolescents and see how long term of these chronic risk factors can affect the brain development.
Yeah, it's incredible. Like we often think that heart and brain, these are two separate topics and things, but your work shows how they are connected even in the early life. Now let's look at a bigger picture, like looking at some environmental and social factor. How do you think income, urban design, or access to safe spaces shapes children's heart health?
So we well, until now we're talking about the biological pathways, the physiology of the pathology on these factors. But as we know, so social determinants of health is strictly related with. So I cannot say blame these kids for not practice physical activity. I cannot blame them. They have not access for the health food, or I cannot blame they cannot sleep well because they have a lot of noise in the neighborhood or violence. So the combination of this factor can determine the behaviors of the kids and my behavior, our behavior, right? So if I don't have the opportunity to walk in my neighbor, probably I'll not walk. If I feel not safe when I walk in my neighbor, if I have a kid, probably I not allow my kid to go the street walking or practice physical activity outside. Or I have a lot of traffic also. So this can determine the behaviors, and the behaviors can relate with the healthy outcomes. And if you live in this also, probably this kid is under stress. So, and we know when we under stress, we increase our blood pressure because a lot of stress hormones increase our blood pressure because we are alert every time. And we know stress can be affect our brain, and it can develop anxiety because of this or depression because of this. And this is very important when we look in these pathways, biological pathways between behaviors and health. Is important to consider this social determinant of health, because my relationship that I found between physical activity and blood pressure or brain, okay, is strong, but not explain this, right? Because I cannot blame the victim, as we said. Oh, you don't practice physical activity because you're lazy, etc., etc., etc. No, because you don't have the opportunity. And as a public health epidemiologist, we have to show this for the publicity and show for the policies to change the behavior, to change the environments. Oh, okay, the health workers or the mayors or the governors or federal have to promote. Okay, you need to promote the environment safety for the population, to promote health behavior, and this have a consequence for healthy outcomes.
Definitely, we need a safe and clean environment to save our children's heart health. Yeah, thank you for explaining that as well. And also, you have worked with population across the globe, like from Brazil to Spain to the US. So, are there any pattern or challenges you see repeated across different settings?
Yeah, so one friend, he's a psychologist, he said, one important thing when we go outside your country and is understand three things: the language, what people believes, and the food culture, right? So
Mhm.
this determine where I live. So, and thinking on that, so for example, comparing Spain, just very briefly to understand. Here in United States, in Brazil also, we take lunch around noon, right? At noon one, and Spain is not. So in Spain, they start your lunch 2 p.m., 3 until 4,
Mhm.
and they have a later night. So it's to work or they still wake up until 10, 11, and they start to work on around 9, 9:30. So this is cultural. If you not understand that, is how can I say the lifestyle behaviors? And inside the public health perspective, another important thing to understand is the public health system. So here in the United States is totally different from Spain or Brazil. Every time I make this report when I was in Hopkins during the spring, during the fall, like happened here, we start the flu shots. List so it's good for you to take the flu shot before start the winter. That's we know every year. And I remember I stopped by in the student lodge to take my vaccine. And when I stopped by there, and the first question of the nursing was, "Where is your health insurance?" I said, "Okay, it's here, but why?" "No, we need to charge your health insurance for the vaccine." Okay. And in Brazil, for example, I never pay for vaccine. So if I not understand the health system, how I can promote health? This is the main challenging when I comparing countries, behaviors, health patterns, prevalence, incidence. That is the most challenge. That is the three, four, if I can say that. The most challenging when I went to Spain for my PhD, when I was in Brazil, when I went to here in the United States, my postdoc right now. So that's if I can say for anybody want to do that. First step now, to walk and talk with the people, how they feel about it, the culture, food, the culture behaviors, standard procedures, and understand how is the public health system in that country. This is the main challenge.
Yeah, these challenges are new things for me as well. Like you explained when I moved to US, and these things were also totally new things for me. So we need to consider all these things when we are working in the public health field as well. So now for our parents and educators listening, what small but impactful action can help support healthier heart in children?
So this colleague, Dr. Altair Souza, he said about sleep. One thing that I try by myself. So do not put an alarm to wake up, put an alarm to go to bed. And you see the procedure and your behavior gonna change. Okay, I have to go to bed 10 p.m. And after some days, your body knows, and that's time you go to the bed. Try to turn down all the screens 20, 30 minutes before you go to the bed, and make some hygiene procedures to go to bed. Go to bed every day in the same hours. Most in the work days, of course, because it's easier, but don't try to change during the weekend. So if you do the weekdays, you go to bed around 9:30, 10, 11. Try to do the same the weekends because it's different from other behaviors. So physical activity or screen time. We don't have catch up for sleep. What I'm saying, if you lost 1 to 3 hours during the weekends, you have 1 to 3 days to restart your body in that time. And this compensate another. In sleep, you don't have that. And this is gonna be so is start to improve your hormone system. And once I improve your hormone system, all the body's cardiovascular system and respiratory system can improve also. So this is the main related why sleep is so important in this case.
Now, for our public health students and professionals, what areas in this field do you think need more research or urgent attention?
Try to understand the complexity between these behaviors and the complexity with the social determinant of the health. And inside the EPI, we need to know to improve our statistical analysis skills, how to understand better this complexity, sleep, screen time, physical activity, and also diet, and how this where I live determine my behaviors. So another professor, she had one of the most interesting, powerful sentence that I read as epidemiologist. So she said, our zip code is more important than our gene code. So what she said is, where you live determine your health. Understand that, I can moving forward to understand the behavior of the population and understand the health patterns. And for the students that are going to listen here, try to understand how this I can understand these patterns, or how I can improve, understand this, how can I improve population health, understand the relationship. I know it's hard. I'm in this field over 15 years, so it's challenging at the same time. This is my motivation to keep in this field.
Definitely, I think this information will help public health student and professional to learn more about research gap and basically urgent attention on this field. Now it's time for the fun part of this podcast, the myth or fact section. Over to you now, Dipali.
All right. Thank you, Bipin. And thank you again, Dr. De Moraes, for being a sport and doing this section with us. So I will call out a couple of common beliefs that our listeners have, and we would love for you to either confirm or debunk these statements based on your research and experience. So if you're ready, we can begin.
Yeah.
All right. So the first one is kids naturally get enough exercise just by going to school and playing at recess.
It's dependent time. Sorry. One thing that I learned from my supervisor in Hopkins, so he
Yeah.
said every time it depends. This is the most sentence for epidemiologists. But if they can play outside up to 60 minutes a day, this is good enough. And we know so active community is for children is very important also, because when we are outside walking on the street, that's one thing why walking and cycling as a transport is very good for brain developing kids,
Right.
because when you're walking outside we receive a lot of information and we interact with outside. If I cross the street, I never pay attention in the traffic lights. I never pay attention if coming a motorcycle or a car and I have to stop. So this is activate my brain so different ways, and also activate my body. So this is one thing that's going to be interesting. And if they play outside 60 minutes, for sure they're going to be improved in health.
All right. Thank you. The second statement is cardiovascular disease only starts affecting people in adulthood.
No. So as I said before, right now, unfortunately, we have up to 10% of the adolescent across the globe has hypertension or high blood pressure. Up to 1 to 5% have impaired glucose metabolism, or they have insulin resistance, or they have higher fasting glucose in the blood. And also, they probably 20 to 30% present obese. So 30 years
Yep.
ago, this could be a problem only for adults, but in nowadays, as your society changed a lot, is not real.
Right. Right. All right. Thank you. The third statement is screen time is just a mental health issue and it does not affect the heart.
No, again, this is bidirectional, right? So
Right.
people start a lot of time in screen time can develop depression, or people have depressions to have a lot of time in screen. But science animal models, until we saw in human research, screen time or sedentary time have a lot of effect in metabolism. So they decrease the capacity of our muscles to contract, and this can increase the inflammation inside the muscle. And one time inflammation have inside the muscle, this can be circulatory, and this can be increase the blood pressure. So it's not only for mental health. also is important for cardiovascular system.
Right. Okay. Thank you. And the last one that we have is sleep is just as important as diet and exercise for a child's heart health.
Yes, for sure. And not the important is not the sleep time, but the sleep quality also. And because we saw kids have wake up during the night a lot, they um they have short period of time, but even they have the same period of time, we know the quality of the sleep is bad. So not only the sleep duration, but the quality, because we have three different part of the sleep. We have light sleep when we start to sleep, we have deep sleep, and we have REM sleep.
Right.
For each one, you have different regulation in our body. So if you or kids wake up during the night, you have more time for light sleep, but less time during the deep sleep in REM. And deep sleep the REM, so this
Right.
is bad for kids.
Right. Well, thank you, Dr. De Moraes. That was very insightful and quite honestly, very important information that not a lot of people have outside of the public health field. So thank you so much. Back to you,
Thank you.
Bipin.
Thank you, Dipali, for hosting this myth or fact section. Now, before we wrap up, is there anything else you would like to share with our listeners? Any final thought or takeaways, Dr. De Moraes?
Uh, this friend of mine, Dr. Alta Souza, said, so it's good when we apply a science in our lives. So just try to keep away from social media as far as we can, and try to step down the screen time, and try to keep close to people that you love, and close your friends, and try to more fun days, funny hours doing your time.
All right, that's the wrap on today's episode on lifestyle factor and cardiovascular health among children. Dr. De Moraes, this has been such an insightful conversation, and thank you for the work you do and for helping us better understand the early root of heart health. And also a big thank you to our listener for tuning in to yet another episode of the Research Collective. If you enjoyed this episode, share it with your friends and family. Until next time, stay curious, stay healthy, and stay active.